Hello friends, and welcome back to our channel. We're going to talk about a serious and significant subject today, the warning signals of brain cancer. Being aware of these symptoms is essential, since prompt discovery can greatly increase the likelihood that therapy will be successful. Even though fewer than 1% of people have brain tumors, it's important to recognize any possible warning indicators. Though these symptoms don't always indicate that you have a brain tumor, you should still see your doctor if they don't go away. Brain cancer is a general term for a group of tumors that grow in the brain. The condition is complicated, and the location and size of the tumor might affect the symptoms. First of all, it's critical to recognize that there are a range of symptoms that brain cancer might cause. It can be difficult to diagnose these symptoms because they might be subtle and frequently match those of other illnesses. Let's examine the main warning indicators. Number 1, headaches. While headaches are common and usually not a sign of something serious, persistent headaches that are different from your usual headaches, especially those that worsen with activity or early in the morning, could be a warning sign. These headaches can wake you up from sleep and also are associated with nausea or vomiting. These headaches may be more severe, frequent, and persistent than typical tension headaches or migraines. If you're experiencing this, it's important to consult a healthcare professional. Next, seizures. Seizures can be one of the first signs of brain cancer. They happen as a result of the tumor irritating the brain tissue. From abrupt, uncontrollably jerky movements to minute alterations in awareness or feeling, seizures can take many different forms. Seizures may result in significant brain damage or bodily harm. Brain tumor-related seizures might vary widely. They could include jerky movements of the muscles, strange feelings, or unconsciousness. Seek emergency medical assistance if you or someone you know is experiencing a seizure for the first time. Cognitive or personality changes are another crucial indicator to keep an eye out for. Speech issues, such as slurred speech or trouble pronouncing words, memory issues, difficulty focusing, disorientation, and behavioral or personality changes, such as being more talkative or emotionally jaded, can all be examples of these. These alterations take place as a result of the tumor impairing brain function. It is important to discuss any noticeable changes in personality or cognitive abilities with a doctor if they are severe or ongoing. The fourth is numbness or weakness. Brain tumors frequently affect one side of the body and result in numbness or paralysis in the arms or legs. This can make routine chores difficult. The tumor's impact on the brain regions responsible for sensation and movement is what causes these symptoms. Seek medical attention if you encounter these symptoms, particularly if they appear out of the blue. Speech or vision issues may potentially be indicators of brain cancer. This can include changes in vision, particularly when tumors impact the occipital lobe. It can also include double vision, blurred vision, and loss of peripheral vision. Trouble understanding and using language. Brain tumor symptoms may include trouble speaking clearly or finding the right words. Problems with coordination and balance could also be a sign. This may manifest as clumsiness, trouble walking, or coordination issues, particularly in cases with brainstem tumors. Tingling, weakness, or numbness on one side of the face or body. These problems arise from the tumor's effects on the brain regions responsible for balance and coordination. It's crucial to get medical help if any of these issues arise. A word of caution. Remember, this video is for informational purposes only. If you have concerns, talk to your doctor. They can advise you on the best screening methods for your individual situation, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. Brain cancer may also be indicated by persistent nausea and vomiting, particularly if there are no other clear reasons for the symptoms. Increased pressure within the brain may be the cause of several symptoms. If you're experiencing these symptoms frequently, it's important to consult a healthcare professional to determine the cause. Who is at risk? Brain cancer can strike anyone, although there are a few risk factors that include. Although it can strike anyone at any age, brain cancer is more common in older persons. Radiation exposure. There is a higher risk for those who have been exposed to high radiation levels. Family history. Your risk is somewhat elevated if brain cancer runs in your family. Imaging investigations are usually where brain tumors are discovered. While slower-growing tumors may be less noticeable and need to be monitored over time, some aggressive tumors exhibit noticeable swelling. Typically, combination of tests is used to identify brain cancer, including neurological exam. This examination measures your motor skills, reflexes, and coordination. Imaging tests. Detailed images of the brain can be produced by MRI and CT scans. Biopsy. A tiny sample of the tumor's tissue is removed and it is inspected under a microscope. Treatment for brain cancer depends on the type, location, and size of the tumor. Common treatment options include surgery is often the first line of treatment for brain tumors. Radiation therapy. Radiation therapy uses high-energy rays to kill cancer cells. Chemotherapy. Chemotherapy uses drugs to kill cancer cells. Targeted drug therapy. Clinical trials for experimental treatments. Side effects can be severe, affecting memory, thinking, motor skills, vision, and speech. Supportive care and various therapies may be necessary during treatment. Although receiving a diagnosis of brain cancer can drastically change a person's life, there are numerous options available to support sufferers. Support groups. People with brain cancer and their families can receive information and emotional support from support groups. People with brain cancer can manage the emotional difficulties of their illness with a variety of coping mechanisms. Talking to a therapist, joining a support group, exercising, and practicing relaxation techniques are a few of them. While these signs can be alarming, it's important to remember that they can also be caused by a variety of other conditions. If you experience persistent symptoms, don't hesitate to see your doctor. Early detection is key to successful treatment. While a brain cancer diagnosis can be intimidating, medical understanding and treatment options continue to improve, offering hope for managing this condition effectively. Remember to consult your healthcare provider for personalized medical advice. Remember, this video is for informational purposes only and should not replace professional medical advice. If you're experiencing any of these symptoms, consult with your healthcare provider. If you found this video helpful, give it a thumbs up, share it with someone who might benefit, and comment down below with any questions or topics you'd like us to cover in the future. Thanks for tuning in, and I'll see you in the next video.